As I said earlier, as we speak, the National Cabinet is meeting. This is the Cabinet headed by the Prime Minister with the state premiers and the territory leaders. And I mentioned they'll be looking at possible new restrictions in this country to combat the coronavirus pandemic. Well, Sky News Political Editor Andrew Clennell joins me now. He's got some word, you got some word, Andrew, on actually something that's going to be put to the Cabinet, something that could be announced tonight.
That's my understanding, that the chief medical officers have recommended new restrictions for pubs, clubs and nightclubs, in that they would be allowed to have one person every 4 square metres. Now, that sounds strange because they won't be that far apart, but if you imagine a venue which is 200 square metres, they would only be allowed to have 50 people in there. So essentially rewriting the licensing rules here to make sure there's more social distancing. They haven't gone the full hog. There was some thought they might do something like ban gatherings over 100. That is not the proposal as I understand it tonight, Chris. The proposal is this situation, one person per 4 square metres in pubs, clubs, nightclubs. I'm also told there's a proposed caps on theatre attendance, and they've decided against recommending the closure of gyms and fitness centres at this point.
It's extraordinary. This is virtually putting this sort of social distancing into a numbers game in entertainment venues so that they're reasonably sparsely populated. Obviously, people are still going to be, chatting to each other, having a drink and whatever, but they're just not going to be bumping into each other so much and crowded in, I suppose, is the thinking.
I think before we came on air you said it's kind of a halfway house. Yeah. It's a half ban, and I think that's absolutely right. What's being proposed here would be seen as better than nothing, I think, by the federal government. They have to work with the states on this. They are state laws after all. But it's not your ideal situation of banning a gathering over a certain amount, but it could save a lot of businesses, let's face it. The question is, when they have these sparsely populated venues, if they pass this through the War Cabinet tonight, what will that mean in terms of how people actually interact in the venues? Will they practice social distancing? You can't really police that.
Yeah, and how do you enforce it too? They're going to have to be very careful. Fascinating stuff. We'll wait and hear more from you, Andrew.
Thanks.
Andrew Clennell there with that breaking news out of the Cabinet meeting. We should hear something from that later this evening. Let's stay on these issues and talk about the controversy regarding schools. I'm joined now by Professor Nick Talley, who's the Editor-in-Chief of the Medical Journal of Australia. Thanks for joining us, Professor. Your view on a blanket ban, shut down nationally of schools?
So, look, what we're trying to do is more than mitigate the current infection, or infectious outbreak. That's what we need to be thinking about doing. We've been doing mitigation. I applaud the government's approach to this. But the data suggests the more aggressive we are, the more effective we are in social distancing, then the more effective we'll be in reducing the number of infections transmitted and the stress on the hospital system, which could be disastrous if we don't deal with it. And the most recent modelling that's come out of, for example, the UK today, from Imperial College London, strongly suggests mitigation alone will not succeed. We've got to suppress the infection. So the strategies to do this is greater social distancing, unfortunately more disruption, and it depends on your attitude to the schools. I mean, there are some models that suggest, this won't really help closing the schools and the universities, but it depends on the assumptions. And this is the problem. We don't really know what are the right assumptions. But we do know this infectious virus transmits to children, and it transmits in large groups even more effectively, or the risk of transmission is higher in large groups. And of course, schools and universities where people are together in close proximity, well, that's the issue.
What of the government's arguments that we've heard ventilated today, and we all understand there's all sorts of rationales here and competing priorities, but they're suggesting that, kids aren't seriously affected by this disease. Of course, they can spread it, though. But secondly, that if they are sent home from school, they may be in more contact with more adults and therefore either get infected or spread infections more readily. And also it could create other social problems, robbing hospitals of medical staff and the like, as people struggle to find a way to care for their kids.
Yeah, look, I have no doubt this is disruptive, and you're right, and the government's right. If we just send everybody home, that's not going to really work well enough. You've got to take a group of strategies, and one of those strategies is to look at ways that you're right, we don't have large congregations of children not at school still occurring, because to be honest, then there'll be transmission. So I understand the conflicting priorities, and there are lots of issues. I mean, the single health professional parent who has a child at school, what do you do? But a staged reduction in children at school, sensibly organised, so that groups who can't do this are still catered for, but others are catered for. That would seem reasonably sensible. The modelling, at least the modelling I've seen, hasn't really applied that kind of approach. That's the issue.
It seems to be happening informally now. I know just anecdotally a lot of parents keeping their kids home from school if they can and if they choose. Also, Pymble Ladies College in Sydney shutting in a couple of days, switching to an online version. There'll be other private schools doing that sort of thing. So we'll wait and hear what the government's got to say on this. But just to extrapolate on that, of course, a lot of people are working from home if they can, but there are still many workplaces where there are a lot of adults mixing day in, day out. This is probably of bigger concern, isn't it, for spreading the virus? And how do we deal with that? We perhaps just need stronger demands from government to not have these gatherings if possible.
We do need to reduce this significantly. This is a real social disruption again, but there's not much choice, unfortunately. You know, if the health system becomes overwhelmed with cases, we'll have terrible social problems. We really need to deal with this now. And if we don't address it aggressively, I understand the government's sort of progressive implementation approach, but to be honest, looking at the data, looking at the epidemiology, one could make a stronger argument, I believe, for more aggressive intervention right now, to make a big difference in a few weeks' time, which will be really important. We just can't wait.
Just briefly, Professor, when you think about public transport, then you must be horrified.
Well, I'm worried about this too, particularly people in crowded public transport, situations for longer periods. I mean, very short trips may not matter, although if there's an infectious person coughing all over people, that's a disaster. Obviously, people who are sick have to stay home. Yeah. Obviously, people need to use their common sense. But I know for a fact this is not happening enough now.